Hello, I'm Hannah Donnett with the Collaborative on Health and the Environment. Change is bringing you the latest environmental health science through our partnerships, calls, webinars, science serves, publications, and social media. I would like to welcome everyone to our fourth webinar in our Agents of Change series titled Environmental Justice Voices Now, Disasters, Cultural Fire Practices, and Building Community Capacity. Our moderator today is Dr. Yoshira Ornelas Van Horne. Yoshi is a first-generation college graduate and received a PhD in environmental health sciences from the University of Arizona. Yoshi is currently a postdoctoral research associate in the Division of Environmental Health in the University of Southern California, where she received a Diversity Supplement Award from NIEHS. Her dissertation focuses on work with the Dene communities impacted by the Gold King mine spill to develop a community-based risk assessment and collaborated with community partners to ensure the dissemination of culturally appropriate results. Yoshi's research focuses on addressing unequal exposures to harmful contaminants that affect structurally marginalized communities. We will leave time following the presentations for a brief Q&A session and panel discussion. You may type in questions during the Q&A feature available on the menu bar at the top of your window at any point during the presentations. After the presentation and our panel discussion, our moderator will read out questions for our speakers to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 70 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Yoshi.
Thank you so much, Hannah. It's a pleasure to be here today to moderate this discussion and presentation. And today for our agenda, we have first, after my brief introduction on what is Agents of Change in Environmental Justice, we will hear a presentation by Dr. Dana Williamson, who is currently an Environmental Health Fellow hosted at the US EPA's Office of the Science Advisor Policy and Engagement. Her research also emphasizes program evaluation and the identification of successful community strategies to achieve policy systems and environmental change. That will be followed by a presentation by Gavin Rienne, who is a PhD candidate in epidemiology and biostatistics at the University of Kentucky College of Public Health. His research focuses on differential mental health outcomes of children in Texas after Hurricane Harvey, and followed by Deniss Martinez, who is also a PhD candidate in the graduate group in ecology at UC Davis. The purpose of her dissertation is to find strategies for California Native communities and their collaborators to create governance and collaborative mechanisms that support tribal self-determination and governance. All of these wonderful scholars, researchers have really great research focusing on community capacity. And with that, I will briefly talk about what Agents of Change is and then hand it over to Dr. Williamson. So Agents of Change was started in 2019 and is a collaboration with Dr. Ami Sota at the George Washington University and Environmental Health News. And really the problem that they saw was that the culture of science is rooted in Eurocentric white patriarchal systems. And really to be able to amplify voices of those that haven't been able to be at the forefront of science communication, Dr. Sota and Brian Brankowski at Environmental Health News thought of a great solution. And this was to create Agents of Change. Which is its mission is to empower leaders from historically excluded backgrounds. So really bringing together early career scientists who have a passion for not only continuing their research, but also science communication to advance solutions for a just and healthy planet. The program has 4 goals, and that is to create new environmental justice leaders, or cultivate new, not create new, inject new ideas in environmental health and the climate fields, increase environmental health literacy among STEM students, and make scientific information more accessible to marginalized communities. Currently, we're a small but mighty team and have wonderful support from multiple sponsors. And through our program, we've been able to date, have about 31 different fellows, doctoral students, postdocs, and early career scientists that come from multiple different backgrounds, including environmental health, ecology, engineering, but all of them really focus on this intersect of environmental justice. For the fellowship structure, it is about a 9-month fellowship. And for the fellowship requirements, have evolved over the last couple of years. But at its core, we seek fellows that are able to write first-person narrative essays, participate in Agents of Change podcasts, monthly meetings, and are able to produce a podcast of their own in collaboration with other fellows. New to this new upcoming cohort, we're also seeking fellows to get more training in science translation, and thus they will be able to develop a product educating community groups or policymakers on a particular issue. To be eligible for this fellowship, students or researchers must be pursuing a degree in environmental public health, environmental justice, or ecosystem, climate, health, and justice, particularly looking for doctoral students, medical students, postdocs, or those working in advocacy, government, or research sector and have graduated with a terminal degree less than 5 years. Particularly also focus on those with marginalized backgrounds, and they have to be based at a U.S. institution. The call for applications is now open, and you can find more information on our website, which will be linked below. And of course, you can also find us in mostly major social media channels, including LinkedIn and Twitter, or you can feel free to email us if you have any questions. And without further ado, I will now turn it over to our first speaker.
It looks like Dana might have dropped off the call. So is it possible to move on to Gavin first?
Yes, yes, I can do that.
Thanks so much, Gavin.
So as I said, my name is Gavin Rienne, and I'm a doctoral candidate here at the University of Kentucky. And, as an epidemiologist, which is what my primary calling is, these last couple of years have actually just really been lionized by my work recently in community communication regarding COVID-19. So speaking to high schools and parents and small groups like that on really understanding what's kind of going on with COVID-19 and things like that. And so today I'm actually going to be talking a little bit about my actual source work and what I do outside of that and what I'm now able to pick back up now that we are at least over some form of a hump with COVID-19. And so in the broad spectrum, I am what you call a population health scientist. And that means I look at large groups as opposed to some clinical epidemiologist that looks at things like, trial groups and whatnot. So to kind of get a start for how I got to what I'm doing and how my perspective began, in 2015, when I was doing my master's project, I worked for AmeriCorps, which is a organization through the US government that gears towards doing civic work and volunteer work throughout your communities. I ended up working with a nonprofit organization called the Greater Louisville Project. And the Greater Louisville Project is this independent, kind of nonpartisan, really apolitical organization that's geared towards collecting data and publishing research and information to connect other nonprofit organizations and local government with meaningful data and understanding of what's going on in the community. Principally, what its focus is as a nexus, and that was really kind of the dream and the concept of GLP, which is to be a nexus for information, and so to be the foundation that other communities can draw upon to do their work. And what they end up doing are they generate these annual reports. Like in this case, I worked on the 2015 and 2016 report. And what I took from them is really is what they do. They call these peer cities approaches. So what they do is they identify these cities. In this case, we're talking about Louisville, and they identified 17 cities in total based on these 200 factors to identify them as appropriate comparative cities or sister cities. And so, of course, like you wouldn't want to compare Louisville to Los Angeles, right? And so the benefit of doing something like this is they do this ranking system. And so it's not to say, you know, to brag and say my city's better than you, but they look at these driving factors that cause poverty or inhibit socioeconomic growth. And they may say something like, in this case, in this graphic here, you'll see 1 in 7 Louisvillians live in concentrated poverty. So that's one factor in the overall ranking. And so if we know that Louisville has an increased number of people who live in something called concentrated poverty, then that means for the people who are developing policy and doing any sort of work improving their communities, they know that this is something that they need to target on specifically, whereas in another area, perhaps the issue is just access to jobs or job placement in their area. And as I said earlier, we generated something called these peer city reports. And I love these reports. We do these graphics and they're really good to do. We do these launch parties that are really geared towards bringing in so many different people. And so one of the things that stood out, and this is within Louisville itself, there's a couple of things that always stand out to me that really made it clear to me why this sort of approach, this comparative county, this comparative cities approach was such a great idea. And it's now formed the basis and foundation for my own current research. And if you look at this image at the very right, you'll see, you know, on average, the least poor counties in Louisville versus the poorest, the least poor on average live 12 years more than the poorest. And so that sort of thing really, those sorts of things stood out to me, and it's really difficult to see unless you do this sort of comparative thing. And more importantly, being able to distinguish between the factors that cause these sorts of outcomes. So how I went from their work to mine, GLP is not ran by independent scientists. They have some doctoral researchers on there. They had, when I was doing it, they had a statistician who was who was finishing his doctorate there, but it's still mostly a non-empirical group of people who are, you know, activists and who are, community organizers who are interested in, generating positive things. And so what I wanted to do is I wanted to take their methods and I wanted to improve upon them. I wanted to, add a standardization ability so that we could expand from looking at something like Louisville and to give other communities, larger cities, and different sorts of organizations the same sort of capabilities and tools to do that. And one of the things that I'd like to expand on, that part of my work is doing something called causal inference, which is a way of seeking more formal causal conclusions. And this is important because when you're working with legislators and when you're working with people who have a lot of money, and you're trying to get them to donate to certain areas, you want to be able to show a variety of ways that confirm the results that you're trying to say. If you're trying to say, we need you to spend money in an area on improving child access to parks, you want to be able to show this is why this matters. We see this lead to this sort of economic outcome on a short-term and then long-term benefit. Now, as I mentioned earlier, my current work really is in Hurricane Harvey, and I look at children's mental health post Hurricane Harvey, and it's a longitudinal assessment. And so for those of you who are forgotten a little bit, Hurricane Harvey was a Category 4 hurricane that that landed in Texas in 2017. And so it stands out for targeted research projects because 3 million children approximately were impacted, 60% of whom were low income. The estimated infrastructure losses, 150 billion, with 300,000 destroyed houses and things like that. And so now, when I began my research with them, in 2020, 20% of people were still saying they were more severely impacted and displaced by Hurricane Harvey. And there was a Vice report at the time that was showing they had reporters and their cameras going down, and they were showing people whose homes were still on stilts. And so that identified to me that how do we assess the community's well-being? How do we understand what's going on in those communities long after a disaster has occurred? Children are really the solution. How I began to understand is that the best way to understand the community's health is to understand children's health. Children are the best indicator for the well-being of the community because children are kind of at the bottom rung. So they experience all of the results and all of the impact of all the community's well-being. If your parents are dealing with poverty, children are the ones who are going to be the most consistent indicator for what that looks like. If your community has less access to resources, you're going to see that in children, their access to parks, their educational opportunities in their local schools, and extracurricular activities, deprivation, things like that. And so to understand children and their well-being is a better indicator to understand the community as a whole. To do that, I began using this national database that's based on something called CANS, or in this case, it's called the Child and Adolescent Needs and Strengths Assessment. And what sets it apart is it looks at the factors that lead to a diagnosis as opposed to examining depression or anxiety. And so it was developed for people like social workers and counselors to ask students who are seeking some sort of social service, basically, what's going on with you? What access do you have to certain resources? How are your parents doing and things like that? These are all the things that we know are precursors to some sort of mental health outcome of import. Now, as an epidemiologist, where do I see our role? Similarly to what the Greater Louisville Project does, I believe our role is to empower communities. I think oftentimes people who are in epidemiology, who are interested in doing and improving community level work, I think it's really important that we step back and we provide the tools and we use our science and our know-how and our capabilities, particularly our analytical capabilities, to give those power to the people, to the activists and to the leaders of those communities, to help them be able to make their case to the necessary legislators and people with the purses, right? And so working with nonprofit organizations, helping them to define clearly determinants of health. And that's really kind of where, on a broad level, overall, we'll refine ourselves and how we work with communities today. So thank you so much.
Great. Thank you so much, Gavin, for that great presentation. We're going to be moving on to our next speaker. So while she's playing for slides, I'll remind you to put in your questions in the Q&A, and we'll get to them at the end after our panel discussion. All right, Dana, if you want to take it away. Dana, I think you're on mute here. Yes, just one moment, turn some technical difficulties. There you are. Dana,
okay.
There you are.
Hello, everyone. Good afternoon. And I'm really honored today to have the opportunity to share insights from my research with respect to best practices of partnership and community engagement and capacity building. And so I really don't like to start a conversation or discussion about environmental justice, which is my lane, and environmental advocacy, without a grounding for this work, as it really is fundamentally linked with the social science researcher that I am today. And so prior to my participation as an Agent of Change Fellow, I was a part of the first cohort of the Robert Wood Johnson Foundation Health Policy Research Scholars Program. And this leadership development program further enlightened me to the impacts that I can have in creating this culture change, as well as the radiating effect that my research can have in the policy realm. And so with the work that I'm sharing today, I'm intentionally pushing the conversation for how we can all be better researchers and scientists. And I'm intentionally agitating that status quo and also giving pause to the traditional ways of engaging with communities, as I hope that this can have a direct path for better science and health equity. And so when I talk about community advocacy work and the importance of centering marginalized communities, I often speak about frameworks and models, as this for me has been the best way to guide equitable practices with respect to community engagement and community-centered research that emphasizes building capacity. And I'll discuss both of these models that you see here in brief as they relate to my research. And so the first framework that I want to introduce is the community engagement continuum. So most recently, I published an article in Sustainability where I discussed this framework, and I've categorized environmental justice related research studies by their level of engagement over the past 3 decades. and I identify if they're also making impactful policy systems or environmental change. But when I use the term community engagement, I'm specifically referring to the process of working collaboratively with communities to address environmental issues. And this community engagement continuum represents 5 increasing categories of involvement and communication. And there's a 6th category that I created and identified in my research that I'm identifying here and terming as community-led. And so I'll just walk you through the stages of what this community engagement continuum looks like, and then I'll point out some specific examples from my research. So in this very bottom tier level of involvement, this is outreach. And this is where communication only flows in one direction for the purpose of informing, and it's solely based on what the researcher deems as important. At the consultation level, there is more communication because the interaction is for the purpose of seeking answers, but the questions are also only primarily formulated by the researcher. But there is some minimal feedback that's needed from the community. The involvement stage is more of a participatory level of interaction. There's a shared understanding of issues and the inclusion of community in identifying solutions. And there's a level of cooperation that represents more of a bidirectional sharing of the information back and forth. At the collaboration level, partnerships are formed here with the community on each aspect of the project from development to solution. So you can see as I continue in describing these different levels, there's increasing involvement and engagement with the community. At the shared leadership level, the final decision-making is at the community level. And traditionally, this is what the highest level of community-based participatory research looks like, CBPR. And then lastly, I've identified this as the optimal level of community engagement as being community-led. This is where the project and the program vision and the priorities are established by the community, and partnerships are building on local strengths in the community. And so here, I know this slide is a lot going on, but I'm going to have you focus your attention to the highlighted words. And I want this to represent my review of the literature. I've highlighted a few examples of what each of these levels look like in practice, in partnership, and in research. And so if you want to gaze at the very bottom, we're going to start with outreach. And so here's an example of outreach. This is really, again, that base lower tiered level where data is merely gathered. It's a very basic level of engagement where information is obtained and provided back to the community. And I often reference this as being the most extractive. This is usually obtained for the sole purpose of research, and there's a minimal involvement with community stakeholders. In this next level of consultation, this is where the information, there's more information sharing, and feedback is only obtained for a specific purpose, and usually it might be for the relevancy of a proposed project or a proposed program or strategy. The next level of involvement, all the previous somewhat minimal levels of engagement occur, but the community is really involved a bit more and takes more of a participation in setting the goals or the priorities of a proposed program or project. And then at the collaboration stage, there's more of a shift that occurs, and this is where we see more significant involvement and collective decision-making from the start of a project, such as involvement in study design, recruitment, and this goes all the way to the dissemination of findings back to the community. And then there's shared leadership. And again, this is typically where many researchers stop. This is referred to as a gold standard, or what meaningful CBPR, community-based participatory research, looks like, in which there's a coalition or there's a stakeholder advisory board that's created that engages in the research planning or the development of strategies and even dissemination more broadly within and outside of the community. And in my interrogation of the data in my systematic review, I found yet there was another level that was missing and not being highlighted. And I reference this as that community-led. And so at this level, this is where the community is leading the work at the project, the program, or the center level with optional input from an academic or a university partner. And this is the most optimal level that I've identified because community engagement does not require the participation of a researcher to implement or push forward the ideas that are proposed. And I see this really as the premier example of true community-centered work. And so also one of the interesting findings from my research, I identified a relationship between the levels of community engagement and research outcomes. And in my work, more than half of the research studies fell into these lower tiered categories of outreach and consult and involve, which I believe is also related to a reason as to why there were so few environmental or policy or systems level changes that were identified in the research. And so broadly, I feel like the takeaway message here is that not only does high engagement have greater benefits to the communities in which we're working with, but higher engagement can also create greater opportunity to align with community priorities, which in turn can maximize your impact, it can maximize your longevity, and even the sustainability of the changes that ultimately I hope that we're seeking to make through our research and community efforts. So now briefly, I want to switch gears a bit and I want to discuss a second framework that I reference across my research. This is community capacity theory. And so capacity building is something, it's just a term that's thrown around in the literature a lot. And it's highly referenced, but it's often discussed very superficially and not operationalized with respect to strategies that are implemented for addressing some of those systemic and structural inequities, making the environmental and social justice, addressing environmental and social justice challenges, how to strengthen communities, and even how to advocate for policy change. And so I use this academic framework that was developed in 1998 by Goodman and others for operationalizing capacity. And here I describe capacity as being comprised of those 10 components that you see: participation, understanding community history, community power, values, critical reflection, leadership, networks, resources, sense of community, and skills. As these are all community characteristics that can be leveraged to solve collective problems. And so in 2020, I published findings from my systematic review of the literature. And specifically, I was looking at community academic partnerships and discussing this framework in detail to identify how and if researchers were actually enhancing any levels of community capacity. So viewing capacity from this lens, I was able to look again at the research over the past 30 years, and I noticed a natural divide between what I consider as basic engagement and deep engagement. And so I label this first set of capacity building activities as more basic and commonplace because the focus was on offering incentives and just educating, creating some shared connection with existing structures, and there were some additional efforts around new or extending existing networks. But these are really what I see as the lower tier hanging fruit of capacity building approaches. They're utilized often in research practice because they require less investment. And these are the activities that tended to apply a limited approach to community engagement from a sustainability lens, and also utilize those characteristics of the community that I consider are also very surface level. And so in contrast, this second set of activities focuses on deep engagement. And in my research, these were, unfortunately, the less frequently documented activities that really require that greater level of intention and investment. This second tier of activities allows for deeper engagement because it aligns with community priorities that are already existing. You're understanding community context. You're identifying ways to support community development, and intuitively, all of these efforts on the deeper engagement side apply a lens towards sustainability. And so looking at across all of the capacity building activities, I mean, all of the dimensions and the activities are important. And these are all valuable ways to engage with the community, but really giving an emphasis to those activities that require the longer term financial and social capital investment that focus on embedding and understanding or situating your research within a historical context, aligning your research with the existing priorities and values of the community, and creating opportunities for skills development really lends itself to greater upliftment and sustained community change. And so just in my last 2 slides, just talking about how these learnings can be applied within the context of partnership. And so really, I view community capacity as a lens to address the inequities and can teach us a way to be more intentional with how we build partnership. I think of these as some of the most important building blocks that should be incorporated into our programs and projects and partnerships that can allow us to be more meaningful. They can allow us to assess the needs as well as build on existing strengths and ultimately create that sustainability. And so if we discuss capacity building in this way, we can add structure that allows us to focus on the meaningful ways that we can support our community efforts. And as from a researcher perspective, I think that using this framework allows us to kind of check our intentions at the door and really assess how and if we as researchers and scientists are meaningfully impacting for the betterment of the communities that we're working with. And we're all here today because we realize that the ways in which we engage really matters. And I won't go into much detail here, but then just broadly, my efforts in analyzing environmental justice work over the past 30 years really shines a light on how our efforts as academics and scientists aren't really pushing the needle and making those policy or community change or systems changes. And so I believe that we might be doing a disservice if we don't really take a look at our work and identify if we're truly enhancing capacity and really uplifting and valuing the communities in the ways that we think is most beneficial for them, then maybe we need to just take a second look at the way that we're engaging or the way that we're doing and conducting our research in a regular practice. And so thank you so much for your time. I know I'm over time a little bit, so passing it on to you, Deniss. I really look forward to our continued conversation today. Thank you.
Thank you so much, Dr. Williamson. While Deniss is pulling up her slides, I want to remind you again, we have a Q&A feature you can use to put in questions. And at the end of the panel discussion, we'll get to those. And I'll pass it off now to you, Deniss.
Hi. Sorry, I have multiple desktops. It's always like a little scramble, but it's so good to be with y'all today. Like Hannah said, my name is Deniss Martinez, and I'm a PhD candidate in ecology at Davis. And I'm really excited about today's panelists. Dr. Williamson, that presentation is probably going to get, that paper is probably going to get cited in my dissertation. So I was really excited about it. But today I want to talk to you all about cultural burning in California, which is a little bit of a topic switch. But I want to, share with you a project that I do with our research group members and also community members, and just generally about the topic. I think it might be new to some of you. So thank you. So I guess to start, some key points for our context here in California are that fire is actually essential to ecosystem functioning in California forests. So this story might be contrary to what you've heard about, raging wildfires in California, and certainly those fires are tragic and really difficult to contend with. But part of the reason those big fires occur is because of the many years absence of active forest stewardship. So Indigenous people were and continue to be experts at this, and through careful caretaking, Indigenous-led fire reduced fuels in forests that led to wildfires that are high intensity. But it wasn't, just managing fuels that led California Native people to burn. Fire was essential for almost every aspect of Indigenous life here in California. And so, what is cultural burning, I guess, is a good place to start. And the answer is actually a little complex, and I'm always a bit uncomfortable defining cultural burning because the term is used to describe a fire stewardship practices of Indigenous people across continents, cultures, languages, and ecosystems. So it's good to know that anytime anyone offers you a definition, it's pretty contextual. And having said that, it's still important for us to start somewhere when we talk about cultural burning. So this very wordy slide is my attempt at trying to give us a starting place. So cultural burning is burning of landscape led by a tribe that has, cultural, community, and ecological goals. It's usually part of a broader strategy that benefits the well-being of all beings, including Indigenous community members, the general public, plants, animals, as well as the broader ecosystem. So those are all kind of factors that a community might consider when they're making their plan for a burn. It's intergenerational, so children and elders are often integral, and this is really different than, say, CAL FIRE or the US Forest Service burns, which are led in a very hierarchical and militaristic fashion with only trained experts. So it's a very different environment that these happen in. So and then so there's a relationship to fire and each other that's less about hierarchy and more about being in good relationship. And again, I am the queen of caveats. This is different in every community, and different people are involved. When burning happens and how it happens might be really different. Again, this is a global practice, and my expertise is mostly in California, and even then it's a huge diversity in California. So fire is so essential in these communities that many California Native people view their cultures as fire dependent. So fire has been used to maintain key traditional food staples like acorn, and has been used to stimulate the proper growth of native plants used for basketry. It's used to maintain a broader ecosystem by reducing invasive plants and increasing the water use efficiency of forests, as well as improving habitat for elk and salmon, which are also traditional foods. So fire uplifts Indigenous food and cultural sovereignty, and also ensures the well-being of California Native communities, again, through that fuel reduction, through access to healthy foods, access to culture. So it's a very important process. And again, the queen of caveats, I just, this list is not exhaustive. And in fact, each of these practices is informed by cultural values, institutions, and knowledge. And so I always like to say that Indigenous knowledge is not just a list of practices, but rather the cultural institutions that put these practices forward. But I think that seeing some of these practices helps us visualize the material manifestation of Indigenous knowledge. So settler colonialism disrupted these Indigenous practices in California by making fire illegal and actively suppressing it using a command and control approach to natural resource management that began in the early 19th century. So Native people continue to practice cultural burning, and settlers use this to instigate violence against California Native communities. So fire suppression has taken the form of violence, like shooting people on site for burning, harassment, and arrest. And so we know that people experience fire suppression as direct violence. However, it has also taken the form of quote unquote slow violence. So slow violence refers to actions that create violence over time, like pollution in people's bodies, or like in this case, losing cultural and healthy foods to fire suppression. These are slow in that it doesn't kill someone immediately, but it causes an increased risk for health and well-being over time. So that is why people like Dr. Frank Lake, who is a Karuk and Yurok cultural practitioner, have framed cultural burning as a spiritual obligation and also an act of political defiance in this kind of broader context of governmental oppression and regulation. So California Native communities are, really leading the way and bringing these practices back. They are making a push to achieve this across multiple sectors, leveraging partnerships, research, and policy to completely change the conversation about fire. So 2 policies to highlight are California State Assembly Bill 332 and AB 642, which both support cultural burning explicitly. So it reduces liability for practitioners, recognizing their expertise and advocating for more support. So these are huge victories. For context, before practitioners wanted to lead a cultural burn, they would have to take on huge liability to do that. And so I'm hoping that, you know, these policies bring great things about in the state of California, and it's yet, you know, it just came out, so we'll see how it goes. So these changes are really only possible via Indigenous leadership in fire, which is getting more and more attention from public, journalists, and policymakers. There are increased on the ground collaborations, which are very exciting. I have a bunch on this page, but I'll just share, you know, there's like a training exchange workshops on the Klamath River, where Indigenous leaders teach participants from all over the world the cultural importance of fire, and several large collaboratives that include partners across jurisdiction, bringing whole regions together to make decisions and do work on the ground. And again, a lot of these efforts are tribally led, which is really awesome. And you know, there are also some great learning opportunities. Those training exchanges are really huge, the ones I mentioned, led by tribes. And then there's also a lot of academic tribal partnerships that are popping up. And so I want to tell you about ours at UC Davis called the Keepers of the Flame course. So this course brings cultural practitioners to Davis in person or via Zoom to talk about what cultural fire is, why it matters, and how to think about it in relation to Indigenous worldviews. So I taught the class last year, and I'm happy, you know, to answer questions about it specifically, but the class is built on principles of reciprocity and cultural humility, and it's also this incredibly interdisciplinary space for students to learn about fire, plants, California history, Native American studies. And students come from across majors in the university. So we spend time hearing from Native practitioners that vary in their experiences and focuses as well. So in addition to our guest speakers, we also take students to 2 sites where we collaborate with partners to create cultural burning workshops. So this is kind of the bulk of our community work. It's you know, our collaborative brings fire workshops together with tribal members, policymakers, and managers. The tribal members get to lead the workshop, and they also get to kind of manage the invite list. And so we can really bring folks that they want to speak with, that they want to engage with. And students and community members get to actually burn landscapes. And this is a huge growth opportunity for all of our students that participate. They get to learn fire ecology, both Indigenous and Western. They get to learn policy and collaboration. And again, I want to emphasize that burning landscape is so important, because that is ultimately the goal of our community partners. So to be able to do even 1 to 5 acres every year, which in the scope of California is maybe a small amount of acreage, but it's huge because we get to create this space with community that to envision how a future could look like, in which we could all be kind of working together in this more holistic, indigenously led way. And so I always tell my students, it's like practice for a more just future. And for us as researchers, the challenges that come up in these discussions at these workshops help inform our research to remove barriers across the state. So we might hear from community members here, like what their experiences are, what challenges come up, even the challenges that come up while we're trying to plan the workshops really help us understand where we could be useful. And also, the relationships. So we bring policymakers and agency leaders to these workshops, and they get to talk to tribal members. And, it's different than other spaces because we get to, talk over lunch or a campfire, or, we spend multiple days and nights together. And that helps build relationships that maybe can't be done in like an hour meeting or an hour phone call that would otherwise happen. So super exciting. And then I'll just share some pictures. So this is one of our students burning redbud. Redbud is used for baskets. And so that's a whole hillside of redbud getting burned. Again, students get to lead. And it's amazing to see, a lot of the women in our group have become leaders as alumni, and that's really awesome. So this is, again, doing some burning, and then we also have Fire Chief for the Greenville Rancheria, Danny Manning, and he comes out and just helps us with safety and etc. He's a tribal fire chief. And he also, teaches us about the materials. So here he's showing us how to start a fire using a bow drill, using cottonwood from the garden that we're burning. And so just to give you a general arc of how the burn goes, we start by, this huge mess of sourberry. And so we start by clipping it. And so you see us, with some clippers, and we're clipping the plants down to the bottom. The plants actually regenerate from the roots. And so we're not killing the plants. No plants were harmed. And they actually, it's good for them, because when they get like this, it can become hard to access water, etc. And so we burn it under the guidance of our elders. And, we make sure that we have safety in place and everything. And really, it's just about being aware and helping our students be aware. And so once the fire is burnt down, something that's different that we do with elders that we might not do with an agency is that we actually rake out all the ashes and mix the soil so that plants can access the nutrients, but maybe not be pushed down by the ash. And so the great thing about this project is that I've been involved in it for multiple years, I think 4 or 5 years now. And 2 years after that burn that I showed you in the previous pictures, we have this beautiful basket material, and these basket weavers that get to harvest a lot of it and make beautiful baskets for the community. And so with that, I'll just say thank you so much, and I'm looking forward to our discussion. Let's see.
Thank you so much, Deniss, Gavin, and Dana, for those wonderful presentations. We touched on initially the idea was to have Dana go first to really ground us in the community engagement continuum, but I think even with that, we got to see more of that deep engagement, right? Both in Deniss's project and Gavin's work. And one of the questions I think for any of us that are always working with communities is, how did those initial partnerships come about, and how are you able to maintain accountability and momentum? And so, I think we'll definitely probably take it over to Gavin first, and then hopefully give the other two a chance to answer that.
So developing the initial partnerships, kind of the big thing. So for me, special GLP was really just the assignment by AmeriCorps. So AmeriCorps just kind of assigns you somewhere. They identify some things that I wanted to do, and then you kind of working with that. And like I said, for me, really since has been, because my time now has been really lionized by COVID-19, as an epidemiologist, you have to really kind of be flexible as far as what you actively do on a more regular basis. But now that, with this hitting this last year of my dissertation work, it's continuing work with state health departments now. It's kind of revving that back up now that they are also moving away from a lot of COVID-19 primary focus and saying, okay, hey, dissertation's happening at the end of the year. I'll be working, doing more work directly. So it's really just kind of reconnecting with people saying, hey, COVID-19 is still happening, but we're all starting to hit some new stride as well, really is how we're doing that.
No, I totally agree. I feel like, at least in a lot of our work, we've been, yay, we know it's COVID, but we have some of these projects that we want to get back to for the timeline. And I think in your case, Deniss, it sounds like you had great mentors that had been, establishing some of this work already at UC Davis. Maybe this is a big assumption, but is that what drew you to the program and your research that already established partnerships?
Well, yes and no. So my advisor is amazing, as an amazing community researcher that does have all of these partnerships. The actual Keepers of the Flame partnership was developed during my time at Davis in collaboration with grad students. And so I think in terms of starting partnerships, I always kind of tell people that it might take time. So I really appreciate Dr. Williamson's spectrum, because I think that could be a really helpful way for students to start to vocalize what they actually have the capacity for in a graduate program. And so my dissertation, I would say, and I might be having trouble remembering, but my dissertation is a lot more community involved or maybe community collaborative, but it's not community led. And then this other project that I'm working on, where we do have more capacity, where we have a research team that can work on these things, is more community led. So that we lead and then they lead, and then we provide a lot of logistical support and funding, and we provide, students and participants and networks. And so I think that there's just a really important thing that can't be missed, is that along that continuum, as you're moving through it, or, as you engage community, you're actually building trust. So they're also maybe looking at you and saying, well, we're not sure if we want to trust you with one of our community-led projects, but maybe, you can be involved, or maybe you can collaborate, and you're, just as much kind of being assessed and as a collaborator as maybe you are thinking about, should I work with this community or not? And so it's so important to build relationships. And I think for me, it helps to start as a student. As an undergrad, I did an internship with the Kaduk tribe, where I, was out in the field for 8 hours a day and really doing, quote unquote grunt work, where I was, counting plants, and, I loved it. But it, it wasn't until later that I was trusted with more maybe leadership positions, or positions where I could lead my own project, and people would trust that I would have the good intentions to collaborate with them. And so I love Dr. Williamson's work, and I'm so excited to cite that paper. So thanks for that, Dr. Williamson.
With my work, I've been able to apply broadly both of those models that I shared earlier with my interactions with the EPA's Environmental Justice Academy. And so this is a leadership development program that has attracted environmental justice advocates and activists through their training program. And there's an intentional emphasis on uplifting skills and creating partnerships and identifying resources for sustainability. But as a result of the participation in the academy, each participant brings forth an idea for a project that they feel is important with an EJ focus and centered with respect to their community that they come from. And so the academy helps to foster like that optimal level of community-led form of engagement. And it also fosters the development of skills. And so the academy in and of itself, while it's sharing and fostering these skills, it's also providing technical support and strategies along the way. And so that's kind of an example of, while we haven't gone out and sought particular communities, those who have an interest have come to us and have expressed a desire to become more versed in the language related to EJ, or how to foster those partnerships. And also through the curriculum, they learn about visioning and creating goals and how to implement a logic model. And so I'm an evaluation person at heart. And so helping navigate how to apply this lens of evaluation helps to maintain kind of that accountability, and helps the participant be able to maintain their momentum and ability to kind of reach out and expand their partnership to keep their work going. So I'm kind of answering this from the perspective of not like the researcher or the scientist who's trying to continue to make sure that the community is on point, but the community-led folks themselves being able to motivate and ensure that they're reaching their goals.
Thank you. And I think especially Dr. Williamson, for your work, you talked about some of like the deep engagement, right? And we see that clearly in both Deniss's work, where you talked about, some of the policy changes that have now have come through. And then in Gavin's work, where you talked about, the technical expertise. And so, either it probably is reflected in some of the theories you talked about, Dr. Williamson, but were there any kind of recommendations that talked about, how academic collaborators can actually help frontline communities, or what can they do to better assist? Is it more along the continuums of technical expertise and creating those partnerships?
So from my perspective, there's different models for the work of scientists. We talk about translational work, we talk about pure theory and things like that. And so for reference, I'm a translational scientist, so I like to really move theoretical work to application more clearly. And so as an epidemiologist, we bring a few different things. One of them being, of course, is the technical work, the statistics and the ability to program and do all those things that puts this really huge amount of data into something that's consumable, and then is able to kind of convince policymakers and people who are sitting, holding the purse strings. That's kind of the more expertise-driven side as far as that can get kind of things done from the high level. But our role when working with community workers is to listen and then interpret. It's like an active listen interpretation relationship. So I have been in situations where a person is telling me that the community is struggling because they see a lot of drug addicts and people who are dealing drugs and whatnot in their neighborhoods. That's a concern for them. As an epidemiologist who does a lot of work around there, one of the things that we know when you're doing community work is that a big issue there, when you see that, are, for example, a lot of abandoned houses. Those are sorts of things that drives that up. So I get to hear the community's concerns, and then my role in this case is to identify sources and causes of those concerns, and then work back with those communities. I'll say, hey, we know this is a big problem. Our data is telling you have a lot of abandoned houses. How do you feel about that relationship? And then at times, in that case particularly, those things, those those dealers and those things like that, they're happening around a lot of these houses. And so you have this kind of active, from my perspective, you play two roles. You're the person who listens to the community workers, and then you kind of be the interpreter for, the policymakers.
Absolutely, Gavin. I mean, I would also say that just, as academics, or we are folks of expertise, we come into a situation and assume that we have all the answers and we have our research questions, and this is what we want to uncover with this particular research. But you also have to recognize that whatever it is that you're doing in a community needs to be mutually beneficial. And so what is it that the community needs from me that may not even be aligned with my research question, or the outcomes that I desire to achieve, but how can I be of service to you? And then this is how I want to help. This is what I see as a priority. Maybe that might not align with what the community sees as a priority, but you have to have some kind of mutual understanding, and the work that you're doing ultimately has to be grounded in being mutually beneficial.
Thank you for that input. And yeah, I totally agree on the mutual partnerships and what it is, because we as researchers, we also, we have goals, and hopefully they do align with communities, but if they don't, I think that's a very good reflection on our part, right? To kind of take that step back and really reflect on what it is that our goals were, or if they don't align with communities. And so I know, well, I'm not really sure who we have in our audience, but a lot of possible future applicants, I think are really interested in hearing how specifically the Agents of Change Fellowship might have enhanced your training. So hoping that you can speak, we'll start with Deniss, you can speak to that. And then also maybe, just provide some insight into, I know you mentioned a little bit about how you really got started as a student. So hopefully some of your insights into how to best start, particularly for those wanting to do, work alongside communities.
Yeah, so I'll start with the Agents of Change question. I think I didn't realize like how difficult it was for me to communicate my science. And part of that is because K through 12 has intentionally stopped people from understanding that there was a genocide in the United States against Native American people. And so when you start at almost like not just that people don't understand your research, but some people don't even know that Indigenous people or Native American people continue to exist or continue to practice their culture. And when you start at that deficit, it's really hard because you don't want to start at like the one-on-one every single time. You want to be able to share your work, and you want to be able to bring people into that understanding in a way that doesn't make them feel like, well, you didn't learn this in K through 12, like you must not be very smart, because that's not it. It was purposeful, and it was a deficit that continues and that we should do something about. And so what can we do to bring people into our research without losing them, And so I think that for me, this exercise, and I realized that it came from storytelling. And so it came from me being able to articulate my own story and put myself into my work in a way that people can really understand, and that people can really connect with that a lot easier than me trying to explain all of this history and and so I really appreciated that challenge in Agents of Change. And I think that it helped me understand to also approach this topic in a different way, from like a very human way. When we talk about fire, and like when I go into a community space and say, well, we should be doing cultural fire, prescribed fire, I need to be really careful also because there's a lot of trauma around fire in California. And so it just helped me lead with my heart and who I am in a way that I really needed to in order to be successful as a communicator in California communities. And then in terms of how to get started working with a community, I'm actually really practical in the way that I talk to students about this. So if you're thinking about a short-term degree, so we're thinking like a master's degree, or you want to get through your PhD real quick, you may want to join a lab or a professor that already has a community-based project that you can kind of plug into, that there's a role for you already, and you would be kind of learning how to do community-based research from that professor, from that group, and you would be building your relationships, but there's already a role and a project that you could graduate with, and that's already there for you. And that's because if you want to work with a community that your advisor or your research group does not work with already, doing a project that doesn't already exist, it takes a long time to develop those sorts of relationships. And you can start by I always tell people, you can start by introducing yourself to community, saying this is who I am fully, your identities, your story, why you're interested in working with them, and what your skills are. And then kind of learn from being in that community, visit, go to events, And then eventually, depending on how busy for me, like tribes are so busy. And so actually going through the whole like research generation project, they may only choose, a couple projects a year that they do that with researchers directly. And so as a student, I always tell people, come up with a proposal and then go to community and say, this is a proposal of what I think could be useful. Let's edit it together. And, you tell me your feedback, just because it's so much easier to critique or to change an already existing piece of text than to just like from nowhere be like, this is what we need and this is what you should do. And, people don't know what's required for a dissertation, and et cetera. And so you need to be the guide that tells people like, well, I really do need to publish in these journals or a journal to graduate. And so that is my need, but we can, do all of these other things. We can fit that into here and just be really clear. Because if they don't know your needs, like not everyone's been through academia, no, and you want to make sure you graduate. And so that's just, I think, the way that I tell people to do it. And then from there, community might provide a lot of feedback or not a lot. They might want to be really involved in every step, or they might be like, well, you got it from there. Like, we'll check back in a little while, because ultimately they're unpaid. And unless, you're rolling in those big bucks as a graduate student, you may not be able to pay them. And so it's just, being really conscious of the labor you require of folks and making sure that they're enthusiastically consenting to being a part of all of that. So yeah, that's where I would go.
I would say that, we all know that doctoral work takes a real toll on like your self-esteem and your confidence. And I really credit being an Agents of Change Fellow with helping me to transition from that really difficult space of not being what I feel like is being at my best, and embracing my expertise and the work that I've spent so many years in developing and really creating my own space and providing me a space to share my voice. And also feel comfortable, as Deniss said, with kind of infusing my personal passions behind the work and why I'm doing what I'm doing and why it's important to me, because that's often just, from an academic perspective, you don't get a chance to share your passions as to why it is that you're doing your work in a journal article. It is very regimented with a finite word limit, and you're taught that you have to be very objective. And so through being able to do podcasts and writing blogs and just sharing my work in a way and translating it into common language has been challenging, absolutely, because that's just not how we're trained, but a really welcomed opportunity, that just allows me to share my work in plain language, and that's challenging too, from a theoretical perspective, but being able to speak about my work in that plain language, and that's really been a welcome opportunity, and I appreciate that, having that foundation, because I plan on doing much more of that, because that's where I feel like our work can be most valuable. We're talking about working with community, and it's not necessarily that all of our work has to be talking with other academics. Our broadest reach is when we can really translate this to common language. And so I think for others that are, wanting to work in this space, or students that are interested in being a part of the Agents of Change, like, we have to recognize that we're trained to impose like these really colonized perspectives on how we engage with communities. And so we often enter a space where like our credentials are supposed to represent everything, and we don't practice like reflexivity. And so we don't encourage all these other ways of knowing lived experience outside of what we deem as most important and what's in our expertise. And so we also have to practice humility and recognizing that our perspective isn't the only perspective that matters. You know, we come to a space and we have a sense of privilege and power. You have to recognize those dynamics at play, and you also have to listen, because if you want to be authentic and you want to center the work of the folks that you say is important, you have to create a space that really elevates their experiences. And that's something that requires intentionality and practice, but it's something that we can all achieve.
Thank you. And I know we're at the end of our time, and there was one question I think in the Q&A for Deniss. You're free to answer it live or type an answer. And of course, I want to give Gavin a chance to respond any thoughts if he wanted to add to any of the comments.
I'll make it quick. I think the big thing is identifying there's a couple of things. You need to identify what role you want to play. And that both depends on your career. So as an epidemiologist, I like working directly with communities, but my biggest passion is working with policymakers. So for me, it was learning to develop skills for how to actively listen and interpret community work. But I didn't, and I still don't, and not the type of person who necessarily wants to be on the ground every day, moving amongst communities, because I know my skill set and things like that are really geared towards working with policymakers. So you really need to think, responsibly and honestly about who you are as a person and what you want to do. It doesn't necessarily mean you don't I'm very passionate about community. So it's not like I don't like that or don't think the work is important, but I know that I work in my best in those kind of spaces of power when those people are doing those sorts of things. I'm really passionate about doing that. And I have a lot of perspectives on how and why that's so important. So I think it's really important to reflect on that. If you are considering going towards a degree like a PhD or, something like that, Deniss mentioned it about, getting attached to one. It's important to think about what your degree is in. For mine is a very analytically driven degree. Get in and finish your PhD. All the community work is going to be there. It's not going to go anywhere. If you can take a little time to start doing a little bit of networking, but get in and finish your PhD. Kind of work in an area that might be of interest to them or whatever, but finish your PhD. You'll leave with all the authority necessary with the 3 letters at the end of your name. Do whatever work that helps, drive you a little bit and give you that last little bit of energy to get across the line, but finish your PhD. You'll know what's best, but yeah.
Thank you. And I think now I'll turn it over to Hannah for last remarks and concluding of this amazing webinar. Thank you so much for sharing space with us today.
Yes, I wanted to thank all of you. I did have one kind of broad question for all of you, and Gavin gets into your policy work that you're really inspired by, but also into the framework that Dana, you presented, and also in Deniss, building trust and this idea of political defiance, as you so eloquently put it. And I guess just broad question, last one. How do you all see both political defiance and community-led science inspiring and spurring meaningful change in environmental health policies and best practices, just from what your work is and moving forward? It's a really big question, but yeah, if you have a case study.
I'll start. I have and continue to argue that you cannot be in public health without being in politics. Doesn't necessarily mean you have to go out and say, I'm a Democrat, liberal, whatever. But we are scientists. And so that does mean that there are definitive truths in how we understand, and more importantly, how we collect information, and then how we interpret that information, and how we conclude on that information. And so I think there is a certain hesitancy among scientists to talk to politics and to speak to politics, to say this individual is leading a series of policies that is harmful to community. But as a scientist, you can objectively and quantitatively and qualitatively say, no, here's the thing they're doing, and here's why we know it's harmful. So, from our perspective, get involved. Say, this is what we're seeing. The thing that you can bring to that conversation is your objective analyses. Say these are the things that they're saying to do, either now or historically, because legislative history, an event right now doesn't happen out of nowhere. Where we are today is there was some result of all of our history, but it's fine to say these policies are directly harmful, and they are going to cause harm both now and in the future if they're allowed to continue. So speak to it. don't shy away from it. Let your science be your shield, because that will, provide you at least some measure of protection that there can be. But yeah, speak to it.
Yeah, I mean, I guess I just want to echo Gavin and just saying that as a person that is a PhD in ecology, I know the stacks and stacks of research that you could pull up on climate change, on fire. We know that it's happening and that it's harmful. And now it's just like trying to get people to collectively act on it. And that's, you have to be involved and in community with people who are making that happen, whether it's policymakers, communities, activists, in order to understand how we do that. And I just, I think that it's the ethical thing to do is to be involved in that, because we don't have much time. And I just, it's so important.
I echo the importance of Gavin's words and Deniss as well. And, I say that I'm one of 40 social scientists at EPA, 40. And there's about 14,000 employees. And half of that 40 are fellows and contractors that look like me. But it's a really exciting time because our administration has identified priorities with community-centered work and capacity building and prioritize environmental justice. And so I'm situated in the Office of Research and Development. And EPA traditionally views itself as this regulatory agency, but I'm also involved in conversations about the importance of also uplifting that EPA is also a public health entity. And all of the work that we're doing, whether it's EJ relevant or EJ focused, ultimately impacts the lives and communities directly and impacts their health. And so right now within the Office of Research and Development, it's a really exciting time because every 4 years, there's a strategic planning process that happens. And this is an opportunity for researchers to participate in the process, share proposals about the work that they feel like is important. That's really going to lead the path that EPA is going to follow over the next 4 years in the areas and the science that we're focusing on. And so I'm honored to really have been able to infuse more of my expertise and uplift the importance of engagement and capacity building around environmental justice. I've been involved in writing a couple of those proposals, and hopefully, they're in like the rating process now. But those are by uplifting the work and the expertise of social scientists. I think like me, like us, we can continue to elevate the importance of science and situate that within the importance of public health. And ultimately, that can radiate and hopefully have a really significant impact on policy.
Great. And Yoshi, do you have any final comments with that question or?
No, I would just say I echo and agree with everyone's input.
Yeah, great. Well, thank you so much. Your work is inspirational. We're going to have to close up though. We're past time. So we're approaching the end of today's webinar. A video recording will be available on SHEA's website soon, and tomorrow you'll receive an email containing a link to the video. Additionally, if you're interested in applying for the Agents of Change Fellowship, you can find details at Agents of Change in ej.org. The next SHEA Alaska Partnership webinar will take place on April 14th. And it's on the urgency of addressing forever chemicals, the scientific basis for managing PFAS as a chemical class, Carol Kwiatkowski. If you're new to SHEA and would like to stay updated about upcoming events or more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website at healthandenvironment.org. Additionally, if you appreciate the SHEA Partnership webinars bringing you the latest environmental health research for free, we encourage you to support SHEA's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank all of our speakers, Dana, Gavin, and Deniss, for taking time to present today, and to you, Yoshi, for your excellent moderation. Thank you so much for joining us. We are wishing all much health and wellness, and have a great day.